Every year, we bring suppliers, providers, Premier, and Yankee together to network, listen and learn, to explore ways to work together and develop solutions to solve problems, explore new opportunities, and drive success. We continue to face ongoing challenges within our supply chain. Disruptions create havoc. Inflation financially stresses our organizations, and labor shortages drive our staff to physical and emotional exhaustion. We need to collaborate to address these complex issues. This executive panel discussion has been one of the most popular sessions each year. It provides an opportunity to hear from our supplier business partners, hear directly from our members, from a very esteemed panel. This year is no different. Sorry, lose my place. Lose my place here. All right, just 1 second. All right. This year, you're going to hear from a different perspective from a CFO, a clinical leader, and a supply chain leader. All three of these panelists have done this before, and it was highly recommended by the Yankee staff and our suppliers to bring them together for the panel discussion this year. Our members work diligently to provide high-quality care, and they can't do it alone. The supplier community makes up a key piece of the healthcare system. We thank our members and our business partners for dedicated service, and we thank you all for taking the time to spend this week to support our annual conference. This would not be possible without the support of our business partners. Let's give them a round of applause. So many of you have attended this event and this conference in the past, and you've been coming here for many, many years, and we really appreciate your support. But if this is your first time here as an attendee, you're in for a real treat. The conference is designed to create a balance of fun and work in a laid-back, comfortable environment. We want you to enjoy yourself this week and request that you reach out to me or any Yankee staff member if you have any questions or need anything at all during your time here. Please feel welcome, have fun, and make some new connections this week. For members, please take this time to visit our business partners and thank them for their support. We encourage you to take advantage of the numerous opportunities to network throughout the conference and have a great week. Now let's get started with the panel discussion. First, we have Scott St. George, Chief Financial Officer, Berkshire Health Systems. Scott joined BHS as the Chief Financial Officer in November of 2020. He has previously held roles in both finance and operations. Most recently, he served as Senior Vice President of Finance at Albany Medical Center, an academic health science center serving 25 counties in northeastern New York. Previously, he served as a Chief Financial Officer overseeing the 3 hospitals comprising the Adirondack region of the University of Vermont Health Network. Prior to that, he served as Vice President of Operations for Samaritan and St. Mary's Hospitals of St. Peter's Health Partners. Scott has a bachelor's degree in accounting from Siena College and a master's in business administration from Rensselaer Polytechnic Institute. Next, we have Jennifer Tarosian, RN, MSN, NEA, BC, who is the Associate Chief Nursing Officer at Catholic Medical Center in Manchester, New Hampshire. Jennifer holds a Master's in Science in Forensic Nursing from Quinnipiac University and a BS in Science and Nursing from Western Connecticut State University. Previous to joining Catholic Medical Center in 2009, Jennifer held various leadership positions within St. Joseph Hospital in Nashua, New Hampshire. She is ANCC certified and belongs to the American Organization of Nurse Executives. She serves as the nurse on the Nursing Advisory Board at Manchester Community College and Riviera University. Finally, we have Eric Berger, the System Director of Supply Chain for Covenant Health. He has been in that role since May of 2023. Eric has been in healthcare supply chain for almost 30 years in both the provider and supplier settings and as a consultant. His provider experience covers organizations ranging from a standalone community hospital to a system of community hospitals and academic medical center anchored health systems. Prior to starting at Covenant Health, Eric was the Assistant Vice President of Supply Chain Technology and Analytics at Beth Israel Lahey Health and served as supply chain lead on BILH's successful Workday implementation. This is the 3rd time that Eric has served a Yankee member hospital. A proponent of healthcare supply chain, Eric served 2 terms as President of the New England Society of Healthcare Materials Management. So thank you all for participating today. So we'll start the discussion with a few questions we received before the conference. And each panelist will respond to the question, and we'll give you a chance to ask them follow-up questions to their responses. Once we complete the questions we received, we'll open the floor to any other questions you may have. So with that, we'll get started. So the first question, we'll start with Scott. is what are your organization's top 3 goals for FY25, and how can suppliers help you achieve these goals?
So I guess when I think about the top 3 goals for our organization and top 3 supply chain goals, the supply chain goals sort of sit within one of our organizational goals. I wouldn't be a CFO if I didn't say improving our operating margin was one of our goals. That's sort of just what we have to do every day. But within our organizational goals, I'm sure for everyone in this room, workforce is a goal. Like how can you actually optimize your workforce? So for us, there are a number of things that we're doing around that. And then it feels like we're constantly talking about this. It never seems to go away. You seem to improve it, and then it sort of seems to come back again, but throughput. So when you think about average length of stay, ED throughput, those issues just sort of seem to come back over time. As you all know, the COVID days changed the way the workforce wants to work, and it changed the way organizations can support hospitals in terms of taking patients out of the hospital once they've finished their stay in a hospital. So those are things that are sort of constant for us. In this most recent year, we've really focused on access. Our organization it's a community organization. We run Berkshire County north to south. We're really the only provider in that county. It's somewhat of a rural county, and we've really made it our goal to make sure that within the county there's access for all services across the county. We're, as I mentioned, a rural county. If you looked at the density of Massachusetts compared to our county, the density of population in Massachusetts is about 7 times greater than our county. We're 1,000 square miles. I tell you all of that because it's not, sort of easy to just provide all the services that as a community we want to be able to provide for the people who live in Berkshire County or who visit Berkshire County. So with that, we've opened up a critical access hospital. We converted one of our outpatient campuses to a critical access hospital. And you might think we did that because there was a margin to be had, if you will. And really, that's not the case. We did that just, it's probably going to generate, a tiny bit of margin opportunity for us. But it was the right thing to do. The northern part of our county would have to travel 45 minutes for inpatient care. We've focused on trying to make sure we've got providers throughout the county. Again, things that don't necessarily generate margin, but it's what we feel we need to do. So I tell you all of that because our focus as a nonprofit is to make sure we serve our community the best we can. To support that, of course, you've got to be able to identify ways to stay sustainable. So supply chain is one of the levers that we use. Every year we set targets for ourselves where we're looking for year-over-year price decreases. So not just slowing the rate of price increases, but actual price decreases. And we surpassed our goal for FY24. We've set another goal for FY25, so that's part of what we do. Again, that's just, I don't want to say blocking and tackling, but that's that is what we need to do every year. As again a rural community with demographics that are flat, we have our revenue growth doesn't come from new patients coming into the community. So revenue is composed, as you know, both of volume and price. For us, there's absolutely no volume. If there is volume, you're substituting commercial payers as they age and folks become governmental payers, so you're actually getting less reimbursement. So again, all of that says that for us, we need to find ways to identify cost savings. High on our priority list, we had started to go down this road and then had to sort of shift gears as we had an opportunity again to open a critical access hospital. So purchase services, and we're working with Yankee on that. We have a very decentralized purchase service process in our organization where there's really no visibility or standardization, and we see that as a big opportunity for us. A third place that we're starting to really dig into is to understand variation within the supply chain across the organization. We have some insight in terms of our own variation, but we have a limited number of proceduralists. So in any particular area, we can dig into what variances or variation we have within our organization, but it's a very small sample size. So we're looking to find ways to increase that sample size. We have a few pilots that we're going to be focusing on. So those are probably three of the things within supply chain. There's a longer list, but everything really is in support of our mission, of which decreasing costs is one place we have to look every day.
Thank you, Scott. Jennifer, how about you?
Hi. So after 3 years of sitting on the panel, I think it's 3, I feel like our goals organizationally don't change, and they probably won't for as long as I'm in the position that I'm in and or part of the healthcare organization. The first being, of course, finances coupled with patient access, workforce, and I'm sitting next to the CFO and I have to go after him, so big shoes to fill, but OPL and decreasing OPL, and then quality and patient experience. From a purchasing perspective, savings is number one, and having our clinical folks involved in the decisions, looking at evidence-based practice when we make those decisions, and then also having staff have the access to the products and readily available so that they're not spending time searching and looking, and then our leaders having the support and resources that they need so that they can focus on other things and not focus on products and such. So I wouldn't anticipate that those will change. I think that's what drives what we do and why we do what we do.
Thank you. Eric?
So from a Covenant perspective, we're probably an outlier organizationally because we're a January 1st fiscal year, not the typical October 1st fiscal year. So we haven't gotten our 25 goals yet. But I agree, it's the same goals. It's about improving our operating margins, procedural growth, and continued focus on quality and outcomes. And I think the challenge from the supply chain perspective is having the opportunity to work on achieving the non-financial goal. Ideally, we would be in the position where we're working with the clinical folks, the quality folks around reducing and eliminating HAIs. What products are we using? How does that impact the care? That's the level, that's where supply chain should be. We're just not there as an industry because of the continuity of supply challenges. So I think, again, those are the same 3 goals. If I'm here next year, it'll probably be the exact same 3 goals. It's operating margin, growth, and quality of care.
Thank you. Second question, starting with Jennifer this time, is how do you measure supplier performance, and what do you see are the most relevant KPIs and how they support your organization's goals?
So I had some help with this one from a clinical perspective. I reached out to our director of purchasing, who I work very closely with, and fill rate. She said fill rate is our number one metric that we use, and it would be great if we had more formal metrics. And we hope to have that soon. In all transparency, I know I've spoken with some of you, and some of you may know we're in the process of being acquired. So that's kind of changing the landscape for us. And there's many more metrics that we hope to have access to that we don't currently have. And then also delivery. So from a clinical perspective, I myself have spent multiple hours trying to track down a piece of equipment that was supposedly delivered, and trying to, send out the all-user email, hey, has anybody seen this? I can't find it. It's missing from the emergency room. Who was it purchased for? Just a lot as far as delivery goes, and how important. It seems simple, how important it is to get the right signature and deliver the product to the right place. I'm not sure that everyone, feels as strongly about that, but it really does take up multiple hours and a lot of energy and resources.
Thank you. Eric, how are you?
So I think the first metric for supplier performance is the number of complaints I get from my staff. If it's whether it's about product availability, pricing, whatever, if my staff is not happy, then that's an indicator of supplier performance for me. Fill rate, far and away the biggest metric from the supplier perspective. Our challenge is translating continuity of supply issues and low fill rates coming into the building with product being available and having a high fill rate coming out of our storeroom to the clinical units. We're spending an awful lot of time trying to maintain a high level of internal fill rate when external fill rate is not always the greatest. Our KPIs are more operational in nature and really are kind of internal, but they do have a supplier, slant to them. Number of new products that have been introduced. Do those go through value analysis? If they're not, who are the suppliers that are circumventing the supply room or the supply chain folks? We're trying to get to a more external looking set of metrics, but we're just not there yet. But that's, I think, one of our 25 goals is to look at how do we measure supplier performance and how do we engage with suppliers in a post-COVID, the old school quarterly business review. Do we do those? How do those look different? Companies are merging, acquiring other companies. A service or an offering that you as a company didn't have 2 years ago that you've acquired in the last 2 years might be a benefit. We need to figure out how to have those conversations and not be focused on fill rate and continuity of supply issues.
Thank you, Eric. Scott, how about you for Brookshire?
There's not much that I would add. I guess just maybe a little historical perspective. Maybe 10 years ago, it's so funny to think back. We were all on the, days in inventory. We needed to have the absolute lowest days in inventory just in time. And obviously that's all gone out the window, and we're all obviously rethinking that and rethinking offshoring and bringing stuff so that you can control the supply chain. So all of that is just because fill rate or back orders, time to fill, those are really the things that seem to matter most given the way things have changed. We do, from a technology perspective, automation, I should say, we do monitor all of our supplier partners around EDI usage and error rates. Those are things that just help us be more efficient, helps the suppliers obviously be more efficient as well. So that's something we spend a bunch of time on. We also have operational metrics around supply cost, and we try to drill down in areas rather than just an overall organizational supply cost as a percent of revenue or expense. That can tell you about yourself, but it's hard to compare yourself at that high level to many other organizations because every organization is different in terms of the mix of services that come through your door. So if you're an organization that has a lot more surgeries, then your supply cost is likely going to be much higher as a percentage of revenue. So where we like to spend our time is focusing on cost per key stat. So use lab, use surgery. It's not necessarily supplier specific, but it allows us to start to see if we have trends, and you can pretty quickly identify if you're seeing costs go up. So then you have to dig in. Is it a supplier price change? Is it a utilization change? What's driving that? And that gives us an opportunity to start to see if we have something that we can do to reverse those trends.
All right, thank you all. The next question will start with Eric. So this past year, Yankee member owners moved to the Premier Ascend Drive and SurePass programs. What attracted you to the program, and what benefits has your organization seen from using these programs?
So Covenant Health was the first Yankee member to move to Ascend Drive. I think it was driven by Kim O'Connell, for folks who don't know her. She's the system director of contracting, and came to us from a facility that had used the old version of the Ascend Drive program and saw the benefit and saw the savings opportunity. We were at the same time working with a premier consulting engagement, so the timing was right to bring that in. So we saw immediate savings. It helps to have the standardization across the system conversation as part of the program. So I think the cost savings were the biggest driver, and I think our success has been having experience in the program before we signed up for it has allowed us to progress and understand what kinds of contracts there are, what do the savings opportunities look like to help drive those conversations.
Thank you, Eric. Scott Elwood for Brookshire.
We obviously, again, focusing on, anything we can do to help be a sustainable organization. When Yankee and Premier brought the program to us, we obviously wanted to look at it and pretty quickly realized that, this was an opportunity to achieve price decreases. But equal to that was the sort of, I don't want to say minimal, because there's a lot of disruption as part of all the conversions that are going on. But there was a chunk of places where we just had to activate price, and we didn't actually have to convert. So, we started off, with an opportunity right from the beginning, and now we're obviously working through, where we're converting, and that's the heavier lift. But that made it more attractive, and I think the flexibility in the program where, we could be at thresholds by category and by vendor that didn't have to be, 100% or out of reach, and in some instances in many instances, there are multiple suppliers, so we don't always have to convert because there's two options for us. So there were a lot of reasons why this change was easy, and of course, it all helps us from a cost perspective.
Right, thank you. Jennifer, how about from your perspective?
From a clinical perspective, it was pretty much a no-brainer for us because when we looked and reviewed the list of products, a lot of those we had previously used, and I'll use the term top-notch vendor, great quality. They appeared to be quality products, and as Scott mentioned, some of it was relatively easy to institute and didn't require much work. We just changed things up a little bit for the clinical piece. We had a smaller group comprised of a few bedside nurses and educators that took a closer look at some of the products, and they were, I would say, a subcommittee of our adult med-surg Tiger team value analysis team, and they really were the ones that evaluated the products so that we could have that happen a lot quicker than our monthly meeting. But overall, the quality was great. I think we're at about 74%, so we were happy to get any savings we could from the program. And it was, I would say, a playbook. Here's what you need to do, and working with Carrie and our team. It was definitely a no-brainer for us.
Great, thank you. So back during COVID, Yankee started a supply chain disruption forum, and that continues today because we're still seeing supply chain disruption on an ongoing basis. Obviously, we just saw the impacts of the hurricanes down in the southeast. So starting with Scott, what can suppliers do to help you better prepare for supply chain disruptions?
I guess, maybe I'll start with the, when we're in the moment where there's supply chain disruption like we're experiencing today, what's really important is timely communication and transparency so that we need to pivot in some of those, in this most recent example. So the earlier we can be aware of that, the earlier we can pivot if there's even, an opportunity to do that, which right now there really isn't much of an opportunity. And we understand, as you're sharing information, Sometimes things can get out in front and maybe be misinterpreted. And through all of that, I suspect you're trying to make sure you can hold on to market share. Because if folks have to move away, it probably is harder to pull that market share back. But I would say, folks would reward that timely communication and transparency, because literally people's lives are at stake right now because some of this. So, not to belabor something that is top of mind and problematic for many of us. But having said that, then as you think forward, what can we all do differently? We've had now COVID to learn from. We've had this most recent experience to learn from. I mentioned inventory builds, inventory buffers. Identifying multiple ways to manufacture, identify multiple sourcing opportunities so that you're not dependent on a particular supplier for something that's critical to your product. All of those, of course, I shouldn't say of course, but they could potentially come with additional cost for the supplier to create, multi-channels, have higher inventories. And I could see where, there's a need or a potential need to pass some of those costs on to hospital or provider organizations. But that's where I think if we can find a way to change that and think about it more as a differentiator for a supplier to be able to go out and say, we're not dependent on any one location, we're not dependent on any one supplier, so that as an organization that wants to do business with suppliers, we know there's some resiliency or redundancy there that protects us in what we do. The next thing that I'd say is thinking out a little bit more. Again, we've got a lot of experience with this, at least in terms of what can go wrong. We internally need to do that same work. We need to work with each of our suppliers, or through Yankee and Premier, to have them collectively work with each of our suppliers so we can understand those dependencies, those manufacturing diversity, diversification, and collectively come up with what would a plan look like as opposed to today, so that we can build that redundancy. And that's a lot of work. It sort of makes my head hurt to think about all of the components of the entire supply chain for each one of our suppliers and all of their downstream suppliers, how we could ever wrap our arms around it. But I think we have to think about what are the critical areas where we should start to begin that work. And I'm certain some folks have begun that work. I think we've maybe thought about it, but to do it in earnest, it's a really, really big project. But I think that's what we have to start thinking about.
Thank you. Jennifer, what are your thoughts?
So I would agree with the collaboration, especially if you're not part of a system, and work together to figure out how we can be proactive. From a clinical perspective, as I was reviewing these questions, thinking back to some of my own experience, on Friday night at 12:30 when you get a call, the thoracotomy kits are expired and we don't have any more, and our neighbors don't have any. I thought, wouldn't it be cool if there was a 24-hour hotline that you could send a picture of the product that is that you're struggling with and you don't have any of, and someone, this is probably AI, not a real person, someone could respond back with, here's the exact one-for-one, because when it's just the nursing supervisor there with the clinical staff and they're trying to troubleshoot exactly at the time because you're out of a product, which we all don't want to be, but let's face it, it happens. It would be really great to have some sort of in-time support for that, to have some sort of backup, because a lot of times we'll get numbers, letters. Is this a good substitute? I'm like, can you send me a picture and then or a sample, and we'll get that to the clinical folks and we can take a closer look at it. That's me. I'm a very visual person, but I would say most of our clinical folks are very clinical and looking at it. But just trying to look through a Thor economy kit in the middle of the night and figure out what's what, it would have been great to be able to phone a friend that had that information and said, here's what you can use from these individual products, and you can build your own kit, so go pick this, that, and that off the shelf.
Thank you. Eric?
So I think we could easily frame this whole conversation around the recent hurricane and impacts on IVs, but it's broader than that. The supply chain disruptions have been going on for a long time, and we still haven't figured out how to manage and communicate any of the issues around those. So I think from a what can the suppliers do perspective, one, be honest about the issues. I don't care why it's on back order or what the problem is. Just give me a realistic sense of when it will be resolved, what my options are. You know, are there alternative products? You know, where does the product come from? You know, we're no longer, you know, just the health system in New England who's, you know, got to respond to blizzards. We're impacted by every natural disaster around the world, because that's where our products come from, or that's where the components for the products come from. So we need to be more versed in where products source from, where components source from, and understand what that means. So if key components come from, you know, let's say Ukraine, just as an example, I need to think about, what do I do with my inventory? Because I'm no longer in the just-in-time world. I need to start bumping up my inventory in these products, because I'm not hoarding them. I'm just bumping up my reorder points. I continue to use the same amount. I just don't allow myself to run as low, because I know how much we need and how long it's going to take, because you've provided me information about lead times based on disruptions. I think it's communicate, but at the same time, don't send generic Dear Customer letters to the hospital address. Those just, you know, the poor guy in the mailroom is going to look at it and go, I don't know where this goes, and it never goes to where it needs to. So I think it's being transparent, but being honest. You know, this is going to be a 2-month problem is better than, oh, it'll be better next week, and next week.
Thank you, Eric. Scott, do you have any thoughts on that topic? What can supply players help you through supply chain? Oh, do I talk to you about that? Do you already answer that question? I'm sorry. Sorry, okay. Sorry, so actually, Eric actually led into the next question. It's a very similar question, but it's more talking about the supply chain as a whole, and how can we work on supply chain resiliency, stability, and transparency. And looking at those 3 aspects of the supply chain, what are the things we want to see, or what do we look for in a supplier partner to help us achieve these 3 aspects of resiliency, stability, and transparency? So with that, we'll start with Jennifer. Do you have any thoughts on supplier attributes we need to see in helping us resolve or prepare for resiliency, stability, and transparency?
I feel like Eric answered that. Transparency, collaboration, and as he said, being upfront about it. This is how long this could potentially go on for.
Okay. All right. Yeah, I think Eric did a great job answering that question, talking about, you know, finding out where the product's made, being transparent with that, and providing that communication, and the timelines, and getting the information to us as soon as you possibly can. And that'll be very helpful for the organization going forward.
Dwayne, I think this is a strange industry. Like, supply chain people don't talk to other supply chain people in this industry. So it's really weird that, you know, I'm not in communications with the director of supply chain at company X. I'm filtered through the sales force, as opposed to trying to have that supply chain to supply chain conversation. Would be very unique to healthcare. I think some of the other industries, manufacturing in particular, probably does that well. Supply chain people are connected to supply chain people. Healthcare just isn't there yet. And I think that's where the greatest potential for improvement would be, is if we can get that interaction from a planning perspective, not just in the disruption category, but in the planning and utilization to help you drive your costs down. If you've got a better understanding of our needs from a supply chain perspective, you can marry that into your production needs and help drive the cost down.
Great, thank you. So with that, we'll open the floor to the audience for any questions. I'll give the mic to Todd to go and pass this to whoever has a question. You can ask about what they've already talked about, or you can ask.
Right over here.
I'm in trouble now.
Yeah, this question's for the entire panel, but specifically for Eric to start. What I'm interested in, thank you, by the way. Really, really enjoy your insights, and I really appreciate the wisdom you're sharing with us today. One of the thoughts I had was around technology, innovation, new processes. What, if you could, share with us maybe, something along the lines of new technology, new process, new innovation that you're excited about, maybe you've already seen positive results from, and share with us anything that you have that you think is going to be a game changer.
Sure, boss. I'll jump right on that one. I think AI is the biggest opportunity or the biggest question mark. Like, how do we, when you look at the broad scope of AI and what it could do and what it could mean, is it as simple as driving efficiency in accounts payable to help eliminate the manual data entry of invoices, which, believe it or not, I know it's 2024, a lot of us still do. So that's one component of it, is how can it drive efficiencies? But then the other is, how can it help us with the planning piece? How do we engage with suppliers who are starting to use AI? What can we learn from our supplier partners around AI to help us expedite our learning curve in that area?
So AI seems like the most logical place to start. I mean, it's just, as an organization, we're proceeding cautiously. We're very interested in AI, but I don't think we've been able to sort of move as fast as I think we would have hoped, just because of how we'd be sharing information with AI vendors or folks who use AI, and protecting our information. We've done some test studies to try and understand, once we give you this information, how do you ensure that it, actually, first, if it's patient level, we de-identify it, but how do we know that it stayed de-identified, those types of things? How do we test or understand better the algorithms upon which the AI logic is based? So if we don't understand the logic, you can get, information that comes back that doesn't necessarily reflect the circumstances of facts as they might exist. So we're trying to work through that to get to a place where we've got sort of a standard process for evaluating AI technology, and when it's sort of a risk matrix of what the likelihood of the risk is and what the impact would be if something bad happened, and sort of working through that on a vendor by vendor basis. But we are, I guess all of that is, I wish we could go faster, is my reason for saying that. And if some of you have figured out how to do that faster, I'd love to have some conversations with you, because I really do believe there's a ton of opportunity for us in the AI space. Short of that, we're constantly tinkering with whatever we can, to automate processes. I'll use even just our contract management. We've yet not created a contract management process for local contracts. We have a platform that, all of our contracts are loaded, as in terms of Yankee and Premier contracts, but we're working on adding the local contracts, which then gives us visibility on accuracy of price and making sure we don't let some of those things sort of slip through the cracks. So, that's something that, we had in place or could have had in place, I should say, earlier, but it's just one of those things that we're getting to now. So I see some opportunity there to be able to do that. Similarly, around the facilities project planning space, again, sort of using technology and software to help gain visibility on our capital process and project planning. Right now, that process happens with limited visibility, and I'm certain there's opportunities to tighten the process and reduce cost overruns, help projects come through more timely. So we've got a vendor lined up to help us with that work. So a little bit more automation on that front.
Okay, so I'll answer from a clinical perspective because I can't speak to exactly all of the purchasing technology. And I don't have enough time to do it justice, but virtual nursing. So in summary, it's having a nurse that can take an assignment that is all virtual and displays in the patient rooms and partners with your direct care nurse. So you can do things from admission, discharge, pre-op checklist, discharge instructions, patient education, you name it. It is amazing, and I can't say enough about it from what I know. I would love to institute it, but we've had tremendous success, and it's been a supplement to nursing, and it's keeping our nurses who would be retired still close to the bedside and mentoring our novice nurses, especially on night shift med-surg units, because no one wants to work weekends or med-surg anymore. And then I would say AI technology, some sort of software for staffing so that the staff is not being, gets 20 text messages and phone calls. And from a financial perspective, the return on investment for this is significant. And then I thought of something else to tag on to what you were going to say. Oh, space committee. Some sort of technology for the space committee, because I sit on the space committee. And I feel like there's a better solution than that. So I would say those are the two big ones and top ones. Virtual nursing, if you haven't already heard about it, if you get the opportunity to hear more about it, I would say check it out.
Excellent. Thank you. Thank you, Steve. Any other questions? Okay, coming right over.
My name is Christina. I'm with Sturdy Health. First time here. Very excited to be here. I have a question on how are you balancing shortages, supply not being there, with compliance for your Ascend contracts? How are you balancing that?
So there is a supply disruption classification within Ascend Drive. So if it's a supplier who is disrupted, that's backed out of your, it doesn't hurt you from a compliance perspective. I think for the broader question, we've migrated to supplier A because they have the Ascend Drive agreement, and they're having supply disruption issues. We're working with the supplier to see if there's alternative products, and worst case, we're going for the short term, to a non-Ascend Drive supplier. The risk being that we would potentially move away and stay away. I mean, that's the risk.
Great. Thanks, Christina. Any other questions? Any brave souls? Nuns.
This isn't more of a question, but just along the AI stuff. We are working on AI at Medtronic with procedural impacts, where we're recording procedures and we're able to find ways to make the procedures become more efficient and more better utilization of product. And the AI is literally taking over. So basically you'll record, say, 25 lap choles, and then it'll spit back the best way to do the lap choles. And it tracks the time and the efficiency, and it's protected through the cloud with Amazon. We're working close with Amazon, but that's some of the stuff that we're working on. We're looking at things procedurally. What can we do to make them more efficient from a supply chain standpoint as well? So more to come on that, but we've invested heavily in that, and it's something that's going to help us to maximize clinical outcomes so that the physicians are using the right products, and they're also taking a look at their procedural films instantly to say, what could I have done better a few seconds after they walk out of their rooms. So something to keep an eye on. It's called digital surgery, touch surgery. It's part of an entire ecosystem. It's going to be part of our robotic technology. It's going to be integrated with that, which will be out soon. We'll be on the market within 4 to 6 quarters, competing with Intuitive. So the AI technology will be integrated with that. So I just wanted to make you all aware of that.
It's really neat. And to tag on to that, I was sitting here thinking too, from a clinical perspective, what, for example, a system that calculates I's and O's exactly, right? I'm looking at my colleague because we continue to struggle with accurate I's and O's. So anything along those lines that is going to make our workforce more productive and increase the quality of care is great.
Thanks, Nunzio. Well, Craig, here you go, sir.
Thank you. Craig Lepar with Inner Surgical. I know a lot of this conference is focused around sustainability, and I did have the chance to talk a little bit about sustainability with the individual members. However, you talked about your 3 goals, your top 3 goals, and nothing's changing while you're in your spots. At what point does sustainability at least crack maybe the top 5 initiatives of your contracting behaviors?
Yeah, I feel like similar to sort of the tidal wave around health equity. Like if you go back 20 years ago, you know, folks were talking about health equity, but in the last 5 years, maybe it's like jumped forward leaps and bounds, and I feel the same about sustainability, and I don't mean to say that I think it's 5 years away. I think we're like right on the edge. As an organization, we've made a commitment to improve, you know, our carbon footprint and sustainability, but we're not going as fast as I think we had thought we would because of some of the other priorities that we shared. But I really believe we're like moments away from the pendulum switching till we really do this in earnest, and I'm excited for Thursday's session to dig in a little bit deeper.
How would you hold your members accountable for doing business with a sustainable company versus a company not practicing sustainability?
Yeah, I think we have to put our money where our mouth is. If we're serious about it, I don't know how we could say, you know, we're all about, and you know, this is a little bit of a contradiction. You know, if you think about, I'm focused on price, but I think we have to move away from price being the sole criteria, similar to how I was talking about patient access in our community. You know, as I know we're doing some things that are costing us money or impacting margin, but it's absolutely the right thing to do, and we're not backing away from that. And I really believe, you know, we're like, again, right on the edge till we're going to say, all right, we're all in. And that's our goal, and we're going to find other ways to support, you know, perhaps the impacts that aren't, you know, as helpful from a margin perspective.
Yeah, I think the margin perspective kind of comes into the total cost of the transaction. So not just understanding what the new product will cost versus the old product, but what does the sustainable product, what does that help us eliminate? And we've got to be able to better figure out how to quantify the cost of what we're eliminating from from an environmental perspective. I think in order to say, so you're not, because it's from my perspective, it's profitability, then sustainability. Can we be sustainable without impacting profitability? And how do we calculate that? I think that's where we need assistance to say, if we bring this in, it means, you don't need A, B, and C from a trash perspective, let's just say. So we're eliminating red bag waste, we're eliminating solid waste, you'll reduce your carbon footprint. We've got to be able to put a dollar to those things so that we can offset the cost.
Thanks, Craig. Any additional questions?
We run out of time for questions from the audience, but I have one last question to ask the panel here. But I do want to say, from a Yankee perspective, we realize sustainability is very important, and we started a sustainability committee last December, and that's going to be focused on this year, looking at the Scope 3 emissions and sustainable procurement. Those are the two things we're going to focus on this year as a committee. And again, we added to the conference this year. We have a sustainability track on Thursday. Because we do think this is going to be, it's a continuing issue, it's going to continue to grow, and we want to start educating our members and on what we can do and how we can help them in their sustainability efforts. So we'll close with one last question here. So what parting words of advice or concerns would you like to share with our business partners? We'll start with Scott. What parting words of advice or concerns would you like to share with our business partners?
What concerns would I share?
Yeah, what are the words of advice or concerns?
Oh, words of advice. Got it. Okay. So, I'm sorry I'm repeating myself a little bit, but when you look at the healthcare industry as a whole, and when I say healthcare, I mean the provider component of the healthcare industry, not the supplier component of the healthcare industry. Nationally, operating margins this year, the median, last couple of years have been zero. So we're in a challenging environment, and so I guess what I would hope is that you could, and you do this every day, you find ways to bring value to us, but maybe think about that a little bit differently. Value to us that doesn't come at a premium cost, because for us, our top line isn't growing. Our price growth is, when you factor in governmental payers, it's limited. So expenses and revenues, the curves are going at different rates, and expenses are growing faster. So to the extent you can help identify ways for us to improve outcomes, but still only spend $1. If last year we spent $1 for the outcomes we received, can we do it next year? Inflation adjusted $1.03, but can we have improved outcomes versus there's a cost to that technology, a cost to improving those outcomes? Because for us, we're living in a world where there's enormous pressure on us to keep healthcare as a cost, as a percentage of GDP. It seems as though it's coming at the providers more than really anyone else in the healthcare space. So we're looking and hoping for your partnership to share that burden.
Thank you. Jennifer?
I just want to say thank you for the opportunity to be part of this, just in case it's my last. So I would say just think about what motivates the organization or the leaders or the directors that you're working with. Some of my best relationships are with those folks that understand that quality and patient and staff are what motivates me. So I think if you come to the table, as Scott mentioned, with kind of, what's in it for me and our patients and our staff, that's always helpful. And then, of course, the savings too. But what motivates our director of purchasing is a little bit different than what motivates someone like myself with a clinical background.
Thank you. Eric?
So I'm the last one between you guys and the bar. I think it's kind of building on what Scott said. It's it's not that we don't care about your company's profitability, but you need to care about ours. You don't want to put your customers out of business with price increases. And it's not just individual company's price increases. It's the industry as a whole. We're facing significant price increases even on GPO contracts. So if the top line is flat and we're seeing increasing expenses, you can do the math. In any other business, we would be out of business if that was the case. So we really need to look at kind of the price increases, the amount of price increases. I know these are tough times, inflation, the economy, but it's the aggregation that we see. We don't see the one-off price increase from a supplier. We're getting hit with all of them. And that's dramatically impacting us. And I think the second thing would be understand our resource and our bandwidth limitations, especially in a high risk or a highly fluid continuity of supply time that we're going through. Our ability to sit down and review things with our suppliers has been significantly reduced because we're just scrambling to get product in. So it's understanding, if we don't, I've met with probably 15 to 20 suppliers in the Reverse Expo. Most of you won't get a call back from me next week. I probably got to go find some solutions somewhere. But give us time, ping us, but understand that, I met with 15 to 20 folks today. It's going to take time to work through connecting back with all the suppliers. So it's just be patient. We have limited resources. We can't, the CFOs are not giving us extra FTEs to help manage the situations. So we just ask for your patience as we go through this.
As you're being patient, don't ping the doctors and the mid-levels without involving all of us. I'm just going to put a big
Amen,
caveat.
sister.
All right, that's a great way to end the session. I want to thank all panelists for volunteering to share your insight today. Thank you very much.